I've had a water room, so.
Okay, we'll bring the Health Service Committee to order.
Okay.
Can I have an approval of the previous minutes? It would have been 2 months ago. Supervisor Gilligan, Supervisor Bruno second. All in favor? Privilege of the floor. Anybody from the public have any comments they'd like to make now before we bring D up? Seeing none. D, you're on.
Good morning.
Morning.
So the first item. That's a little high for me.
You get comfortable.
The first item on the agenda is permission to amend our contract with Countryside Adult Home for our meals to reflect the inclusion of the Johnsburg meal site. We had a retirement at the Warrensburg location, and because we're having a hard time finding coverage for time off, we decided to consolidate the preparation of the meals at that site at Warrensburg, and then Johnsburg will still have the congregate dine-in location and the home delivered meals.
Okay, can I have a motion to bring that to the floor? Supervisor Runyon, Supervisor Gilligan on the second. Any questions? Okay, call the question. All in favor? Opposed? Carried. Okay, D.
Okay, the next item is permission to amend our contract with the Salvation Army to reflect a 2% increase in the price per meal cost. They haven't had an increase since we started the contract, but due to labor costs, food supplies costs going up, we decided to do the increase. It goes from $9.72 a meal to $9.91, I believe it is.
Okay, can I have a motion to bring this to the floor? Supervisor Runyon, second Supervisor Bruno. Any questions? Supervisor Bruno?
Yep. When did the contract start?
It was, I think, May 22, maybe?
May 22.
That's the day of the bid, or that's when the bid was in 2022.
Okay, thank you.
Supervisor Pritchett, you had a question?
Yeah, just who initiates the increase, the 2% increase? Is that a request the Salvation Army makes to us?
Yes, yeah, when we
Okay.
go to do the contract renewal, they have the option, there's a 2% increase built into the RFP if they want to do that, or they can keep it the same. They just can't go over the 2%.
Okay. I didn't catch the point that we're renewing a contract. I thought it was just a change to the existing contract, but that makes more sense then.
Yeah, it's renewing and increasing.
Thank you.
Okay, we don't have any questions? Okay, all those in favor?
I
Opposed? Okay, motion carries.
Okay, and the next item is permission to enter into a contract with GeriFit to provide the GeriFit evidence-based health promotion program to seniors in Warren and Hamilton counties. There's initial startup cost of $2,530 to get the license, and then an annual renewal fee of $150. This program is 90% reimbursable, and then it's split between Warren and Hamilton County.
Okay, can I have a motion to bring to the floor? Supervisor Bruno, second Supervisor Runyon. Any questions? Supervisor Bruno?
Could you explain this a little bit, exactly what is it? What does it do?
So it's an evidence-based health promotion program, which we are required to do by the state. We were doing a different program before and didn't actually get it off the ground before the person retired in our office. But GeriFit. Sure if I have anything with the details on what it is, but it's basically to promote exercise within our seniors, their mobility, help with their health, things like that.
No, I think it might have been in your report, your annual report.
We do have something about the evidence-based health promotion in the end, yes. But what happened is the person that was doing the chronic disease self-management program retired. So the new person that we hired, I gave them a list of the programs, and this is the one that they selected. But all of it is, it's to promote health and well-being.
Through
for
exercise?
seniors. But the specific details of the programs, I'm not positive, but I can get that information for you.
Okay, thank you.
Supervisor Runyon?
Does this happen like at Countryside, or that they go to the homes? How does that work?
What would happen is we can either offer it virtually. It's typically a 12 class program that the seniors participate in. We become trainers so that we can offer it to them. We can do it virtually in the office at the different meal sites,
Oh, I
locations
see.
like that. We wouldn't go into the home because that would be just one person,
Right,
and we'd want it like a group of people.
I see. Thank you.
Okay, any other questions? I'll call the question. All those in favor?
Aye.
Opposed? Carried.
Okay.
Discussion item.
So we have our annual report, which is this right here. I emailed you guys a color copy this morning because it might be easier to read it in color.
Yeah,
And
it
then-
would have been.
We don't have color printers in our office, so
So
Saving money.
did you possibly bring one of those color ones? Cause as I was going over those figures,
Mhm.
it was very tough to see, break down what was given for money and how many people.
Yep. Well, I have a presentation to go along with it, a slideshow, which
Mhm.
does have some colored information on it.
Cause it was pretty interesting. I don't know if you saw it, cause there's been some decreases and then, I was looking at one of them, and I think it was Chestertown decreased and Johnsburg increased. Are they all moving out of Chester and moving into Johnsburg?
It all just depends on who's in the area, who qualifies for the meals, who needs it. And then the people that are on it, they leave either because they go to a nursing home, hospital, they no longer need it, they pass away, things like that. So we have no really control over the number of clients that we have getting the home delivered meals or congregate. It's all up to them.
Yeah, well, it's interesting. It'll be even more interesting to see it in color.
Yes, yep. All right, so here we go. So we'll go on to the next one. So we represent both Hamilton and Warren counties. This gives the details, the same ones that I gave last year about how it came about. But basically, we do split up our funding based on the populations of Warren and Hamilton counties, or based on the directions given to us by NYSOFA. Sometimes they tell us it has to be 50-50. Otherwise, we do a 20-80 split where Hamilton County gets 20% and Warren gets 80. All right. This tells you who oversees us. So we have the Warren County Board of Supervisors, Hamilton County Board of Supervisors. At the federal level, it's the Older Americans Act, and at the state level, it's the New York State Elder Law and the New York State Office for the Aging. Go to the next one. So this is pages 3, 4, and 5 in your handout. It goes over the breakdown of the funding that we get. In the handout, it does give you specific examples of what's underneath each source, whether it's 3B, 3C1, 3C2. But then in the right-hand column, it tells you how much is covered by the state or NYSOFA, and then the maximum amount that they give us. And the reason I do the maximum amount is because with our 3C1 and 3C2 program, even though it says it's 90% funded by NYSOFA, we actually, as the counties, contribute a lot more than that because we only get a maximum amount of dollars. With our 3C1 and 3C2 for last year, for 2024, the amounts were higher than they normally are. And that's because the NYSIP amount was much lower. So NYSOFA tried to help us out by giving us more in different areas. So that one is the federal amounts. Then you've got the state funding. And then the last slide is our COVID funding. Of this part, yep. So we have used all of the COVID stimulus monies that we have received. So we no longer have any more stimulus monies to use going forward. And that will come into play at the second to last slide that I show you. Okay, so the next one goes over the programs, the services that we offer in our office. Just bullet points, and then I'll go into detail about them. The next one. All right. So each of these slides, it tells you what we actually provide under the program, who it's provided by. So whether it's our staff or we contract it out, and then the funding programs that we use for it. So for the first one, we have the application assistance. This is where we help anybody 60 years of age or older with SNAP applications, farmers market coupons, HEAP, temporary assistance, Medicaid, EPIC, or MSP applications, amongst many other ones. And that is typically done all in-house. Next one. So then we have our legal assistance program. This is funded under our CSE, and we're required to do a minimum of 7% of our 3B funding, but we do it under CSE, which is allowable, and we actually pay more than the 7%. Typical things that we do under the legal assistance is landlord-tenant disputes, Social Security, SSI assistance, powers of attorneys, living wills, healthcare proxies, those types of things. We contract this out with the Legal Aid Society of Northeastern New York, so we don't actually do it. They do it for us. For 2024, we had 49 clients receive over 152 hours of services. And typically what we see is the healthcare proxies, living wills, those things. Then we have our HICAP program, which is the health insurance counseling program. This is one of the big components of what we do in the office. We have 2 dedicated staff members to do this because it is so involved. It's not just a quick 5-minute phone call. It's an hour or 2 process. We basically go through all of the programs that are out there and let them know which is the best health insurance plan for them. We do this internally, but then we also have a contract with Greater Glens Falls Senior Center to help us as well. Last year in 2024, we provided over 2,842 units of service to over 1,000 clients. So over 1,000 seniors were assisted through this program last year. And we have New York Connects. This is basically where we provide information and assistance on long-term care services and supports to individuals, caregivers, families, and then providers as well. We have a lot of providers calling us to find out what's out there for people. Is there a question?
No.
Okay,
So
just
far,
want to make sure.
very good.
As part of the New York Connects program, we are required to have a long-term care council. This is made up of consumers, caregivers, providers, agencies throughout Warren County and Hamilton. And then we have also combined with Washington County, so we have a more robust long-term care council. And the council meets quarterly. Basically, we go over or identify gaps and barriers in service and try to find solutions for that. So in the office, all of our staff are trained to do New York Connects. Last year, we had almost 600 clients get almost 1,000 units of service. And then we had 12 outreach events where we go out in the public and educate them on what we can provide. Then we have our transportation program. With the transportation program, we have medical transportation and social transportation. Our medical transportation is done with a contract with Tri-County United Way and then the Association for the Blind. And then we also do mileage reimbursement for volunteers to pay people with this. Social transportation is done through contracts with most of the towns and then through the Warren County Veterans Services. On the next slide, it gives you some more details, and this is pages 9 and 10 of the handout. It gives you details of the amounts of the contracts, the number of trips, the units of service, each stop is a unit, and then the number of clients served for each of the contracts. Overall, in 2024, we had 155 clients making over 2,500 stops. So this is a very good program. Then we have our family caregiver support program or respite care. And this is a program designed to assist the caregiver, setting up respite care, caregiver counseling, support groups, information and assistance, those types of things. So the staff in the office provide the case management piece or the caregiver support program. And then we have contracts with Greater Adirondack Home Aids and Hamilton County Public Health to provide the actual respite where they go into the home and they stay with the care receiver so the caregiver can get a break. In 2024, NYSOFA made some changes to this program, which were very cumbersome, and it increased the amount of time that we needed to do on the administrative end. So therefore, it decreased the services we could provide. So we were contemplating whether or not to continue the program. NYSOFA did make some further revisions and now it is much simpler. So we reinstated the program for 2025. So this is why our data for 2024 is a little bit lower than the previous years. Anybody that was getting the services while we were in that flux stage, we put it under ISAP instead. So nobody stopped receiving services. Next one. You skipped one. Is it not in there? Okay. Maybe it's not in there. So we'll go on to information and assistance. This is a big bulk of what we do, and this is where we help anybody with everything, from where to find salt during the winter to getting meals set up. We provide this both in-house, and then we have contracts with the Greater Glens Falls Senior Center and the Association for the Blind. Through the contracts, we had 76 clients getting over 160 units of service. In-house, we had over 1,000 clients getting almost 4,500 units of service. So that was 4,500 contacts with seniors or individuals within the counties. There it is. I just had mine reversed, sorry. So the Disease Prevention Health Promotion Program, this is where we assist seniors with their health, trying to improve it, their safety, things like that. So there's the evidence-based portion, which is what we're going to be doing with the Jerry Fit, and also Bingo Size, for 2025. And then there's the non-evidence-based, which we do under CSE funding. And this is where we have a contract with Hamilton County Public Health to provide yoga services and Warren County Public Health to do the blood pressure clinics. So in 2024, we had 88 seniors getting their blood pressures taken, a total of 234 times. The next one is our ISIT program, which is the expanded in-home services for the elderly. This program is designed to keep our seniors in the home as long as they are safe to be there. So under ISIT, we have case management. So anybody that's in this program gets case management services. We either contract with Greater Glens Falls Home Aids or Greater Adirondack Home Aids to do the case management piece, or we do it in-house. And then the individuals receive either PC1, which is housekeeping chore services, or PC2, which is homemaker personal care. That's more hands-on. These services are provided through contracts with Greater Adirondack Home Aids, Hamilton County Public Health, Home Healthcare Partners, and Home Aids of the Central Adirondacks. Then we have our PERS contract with the American Medical or Connect America, and this is for the personal emergency response system, that Life Alert button. We also do social adult daycare, and this is through a contract with Countryside Adult Home or Fort Hudson Health Services. So this slide goes into details, the next one, of the services provided under the Greater Adirondack Home Aids, the personal care services for 2018 through 2024. In the first column, you'll see the number of PC1 units, which is that housekeeping, shopping, chore service. Then the number of clients served under that program. Our PC2 units, which is bathing, dressing, more hands-on. The number of clients served in that program and the total amount of funding used for last year. So for the years. So for 2024, we had 44 clients getting almost 5,500 hours of service. Just through Greater Adirondack Home Aids. And then the next one gives you a breakdown of our PERS services from 2018 to 2024. So we currently have 33 clients getting the PERS units, and we pay monthly, and that's what the units are. Each month is one unit. So we had a total of 328 units provided last year. And then this goes over our nutrition program, which is the biggest thing that we do in the office. Or through the department. We have our congregate meals, which is the dine-in, where basically people go to the meal sites to have their meal, and they have socialization as well. In 2024, we served over 27,748 meals at the congregate locations. And then the next slide goes over the home delivered meals program. In 2024, we served over 8,171 meals. We delivered the meals to the clients' homes, which is a pretty large number.
This is countywide?
This is both Hamilton and Warren counties. These numbers here. I can give you the breakdown for each specific county if you'd like.
Oh, that's fine.
Is the home delivered, well, so
Go right ahead.
the home delivered meals category, what we commonly call Meals on Wheels?
Yes,
Thank you.
absolutely. So then as part of this program, we also have nutritional education and nutritional counseling, which is provided by our registered dietitian. All of this program is either done internally with our own staff or through contracts with Countryside Adult Home, Salvation Army, Adirondack Community Action, which serves our Hague residents, Mom's Meals, or then the dietitian herself. And then the next few slides go over the actual breakdowns for each individual meal sites. This is where you've got some color.
Yeah, but unfortunately, it's so far from me, I can't see
It is, but I'll tell you numbers. So we have our congregate meals served, home delivered meals served, congregate contributions received, and home delivered meal contributions received. So for Bolton, we had 449 congregate meals served.
And let me get the poll. Okay, go ahead, I'm sorry.
Yep. For home delivered meals, we had 2,481. And then the total amount we received in contributions was $1,755 for last year. And then the next one you've got is our Cedars meal site. This is the biggest meal site in Warren County. We served over 55,000 meals, both congregate and home delivered. And we had contributions totaling $39,500.
Yeah, what color is contributions on there?
So contributions is,
Green, would that be the end one?
yep, the last two.
Okay.
Cedars is the Salvation Army contribution. Yep. Yeah, so it's,
Interesting to see the different level,
yes, yep.
cause a lot of them went down.
Some of them did, yes. And the contributions, those are based on what the clients are able to provide to us. We have no control over that. That's all voluntary. Some are able to pay, some aren't. So it all
Who
depends.
takes care of that money when it gets here?
It actually goes to the treasurer's office. And then they deposit everything for us. Each individual meal site also gets money too, and they deposit it into their individual bank accounts. And then we get reports, every month. The statements.
No, what do they do with that one?
That money goes back into the program.
Okay,
Yep. And we use that money like it's a budget line on our budget for the overall year. We have separate budget lines for that. One's for congregate, one's for home delivered meals, one's for managed long-term care companies, and then we have a Warren County and a Hamilton County one. So we do allocate for all the monies. The next slide shows our Chestertown site. This site, we only do the home delivered meals currently, and we have 4,164 meals for last year, and we received a little over $700 at that site in contributions. Then we have Johnsburg. We had 2,976 congregate meals, 4,783 home delivered, and then a total in contributions of $12,000.
wow.
Lake Luzerne is the next one. This one is very large congregate dine-in numbers with over 7,000 meals served out of that site. And then their home delivered meals is only 4,636. They have a very robust congregate senior center program there. Their contributions total just over $20,000 for last year. And then the last one is our Warrensburg location. This one we served 13,736 congregate home delivered meals, and we got about $6,800 in contributions from them. And then this one goes over the average cost per meal for, you've got 2024 first and then 2023. So you can do a comparison from one year to the next. And it's for each of our meal sites, both Warren and Hamilton County. Yes. Oh, yes. For a smaller meal site, where you're not serving as many people, the costs are going to be a lot higher, like Bolton. Cause it's, I think we might serve like 15 people out of that site. And yeah, I got a full-time staff person plus all the fees associated with the meal site. So their cost per meal is a lot higher. Across the board, the average cost per meal was $13.67 for last year.
Now, each day they do this, it's a different meal?
Yes.
I mean, what is kind of like the variety, a chicken, a beef, fish?
Yeah, we try to do one beef a week, one chicken, one pasta. We have to have protein every day. We have a 5-week menu cycle and we do it for 3 months. So every quarter we have a new menu that comes out for that week. And then those 5 weeks, it recycles within that quarter.
Each site, it's the same meal each day.
Yes.
So we
Yep.
don't vary from one site to another. What we do, everyone gets chicken one day, pasta, and okay.
Yep.
Yes, Supervisor Fish.
Question, one is, I'm assuming Hague's not listed mainly because we only have Meals on Wheels and our numbers are so low that we're not even ranking really in any categories.
Yeah, so for Hague, we have a contractor do it. It's Adirondack Community Action. They actually provide the meals for our Hague residents. So I could get those numbers, but we currently have, I think it's 3 people getting meals.
Yeah, I thought though that it was like more a volunteer basis, because they come into our town hall, they pick up the meals and then they bring them and I thought that, but we actually pay this contractor is what you're saying.
So we pay the contractor to prepare the meals and then we have volunteers that deliver it.
Okay,
Yeah.
yeah, that's the way okay.
Yeah.
And one other question, And I briefly lived in Florida and, we had something called the Harry Chapin Food Bank. And, this guy started it well, he started this program, he called it Feed the 5,000 now. But what he figured out with this buying power is that for $1 a day, they could feed a person. And I don't know, I mean, clearly 10 years ago, things have gone way up since then, but are we utilizing our buying power to the best of our ability?
So we have the Warren County bids that we use to get all of our foods and supplies. A lot of our costs are employee costs. That's about half of the program. And we have so many meal sites that each meal site has to have a staff person or two, depending on the location and the numbers. So that's where a lot of our costs come in.
The food in itself, are we getting like a heavily discounted price one day when I walk into the grocery store?
I don't know if we are or not. That would be a question for Julie Butler.
She's pretty efficient on, getting pricing. I'm sure she does a pretty good job at that. She's saved the county countless dollars. She's very up on this stuff, but we can always check and see, but I have total faith in Julie. But
Thanks, Mr. Chair. We could do a separate presentation on that if you'd like, if you're interested in.
Oh, okay.
no, it'd be nice for them to know.
I'm certainly not challenging what we
No,
do.
good question.
Right.
And the more meals that you provide, the lower your cost is too. So it depends on how many people are on the program at the time for each meal site. So it
Sure.
could be lower if we have a lot more people getting the meals from that area.
Yeah, I think, maybe their difference, what I was describing in the state of Florida was a program where people would just be able to just show up, and have a free meal that just had nothing else. Maybe it's very similar. I'm not
I
entirely
think
sure.
that would be probably something that the Salvation Army does. They have that kind of power. They can get reduced pricing on things based on the quantity they get. And that's why we have that contract with them, because it's supposed to be a win-win for us, where they can get lower prices, probably for the same items that we're buying, but they are able to purchase through multiple entities, where we have just our bid sheets.
Thank you.
Yes, Supervisor.
We have something in our town where, once a month they go down and pick up food. I don't know where they get it, but it's free and there's a list that they order from. And, but people can come into our town hall anytime for food. Is that through you?
No, that's not through ours.
So
That's regional food bank.
Yeah,
Mhm.
Down in Latham.
Oh.
Yeah.
So
Down in
every town
Latham?
can do that, right?
Yeah, there in Latham also, there's a program over in Greenwich, Comfort.
Comfort Foods.
That
Yeah.
also distributes foods,
Mhm.
senior centers to food pantries, to town halls, those types of things.
Does every town do a monthly gleaning like we do?
Chestertown does, Hork and Warrensburg, combined, don't do a monthly thing, but they do a number of, almost weekly types of stuff. That's a little bit larger.
Mhm.
So, yeah, I think every town in the county has something. In the case of like Hague and Stony Creek, like Thurman, it's right out of the town hall,
Okay.
so.
Okay, any other questions?
So I've just got 3 more slides for you. So this gives you the breakdown of the actual expenses for Warren County for each quarter from 2019 until 2024. And then the total amount on the very bottom line, that's in that first graph, or first table. In the second table, it tells you the actual county share. So how much Warren County has contributed towards it from 2019 to 2024, for each quarter. You'll notice that in 2019, the total contribution for the county was $677 and some change. For years 2020 through 2024, it's been much lower. That's because of the COVID stimulus monies that we received. So for 2025, because we've expended all of them, our expenses, the county share should go back to the 2019 levels, and we do have it in the budget. Okay. Some of the highlights for 2024 on the next slide was the starting the social transportation program through the Warren County VA. That has been going very well. They go out every Tuesday and Thursday to the different towns and provide transportation, to the grocery store, post office, bank, wherever the person needs to go. Our social adult daycare program reopened at Countryside Adult Home, and that has been going very well as well. We also started doing case management in-house for Hamilton County. The farmer's market distribution, this is the first year that we distributed all of our coupon booklets. So we had over 325 people get those coupon booklets. And then our senior cookout, we increased our attendance by 100 people in 2024. So that is going really well. For 2025, we have it set for September 25th at the Fish Hatchery. And then the last slide just goes over some additional information. It tells you how much we received in contributions for the congregate program, home delivered meals program from the managed long-term care companies. And then it tells you the number of meals that we served. So we had 221 new people start meals in 2024. 238 discontinue. And like I mentioned before, typically people discontinue meals because they go into a nursing home, hospital, they pass away, move in with family members, different things like that. But those are the typical reasons. And then currently we have over 350 clients getting home delivered meals in Warren and Hamilton County, and it gives you the specific breakdown. Any questions on the annual report?
Oh, it's very
Yeah.
informative. The only other question I have is, does seasonal people, does that reflect the numbers at certain times?
Yes, yeah, we do have seasonal people, both in Warren and Hamilton County. So they may come on to meals for June, July, August, September, and then they're off for the rest of the year. Yep, so that does happen.
Okay, any other questions for Dee?
I do have just one more item
Okay.
on the agenda.
By all means.
This one is not great news. It's just to kind of give you guys information on what the proposed federal budget for 2026, what the impacts could be on our department. So we're gonna see a reduction in the amount of monies that we receive for aging network services, Alzheimer's disease support program, the congregate meals program, home delivered meals program. And then there are also certain programs that are slated to be eliminated completely. Those are all of the evidence-based health promotion programs, Lifespan's respite care program, which is for caregivers, the long-term care ombudsman program, elder justice and adult protective services, aging and disability resource centers, and the state health insurance assistance programs. And that's just within our entity. Across the board, there are various other programs that are slated to be eliminated or reduced. So we're just encouraging advocacy. I do have a link where you can do a sign on to a letter that goes to our politicians, other than you guys, to advocate for our funding to stay neutral or to not be reduced as much. Because while we might have some direct impacts, there's also going to be indirect impacts as well.
Well, you're right, that wasn't good news.
No, no, because it is there, it's going to drop quite a bit. And then
What's the percentage? You have a ballpark?
I don't know. I do know that the evidence-based health promotion program, like I said, is going to be completely eliminated. So we would no longer be able to offer that, both under Title 3D and under CSE, which are contracts with public health. We would no longer have some of our health insurance counseling monies, which is a huge thing that we do in our office. And then our New York Connects monies may be affected as well as the nutrition program.
I've heard that health insurance thing is very good.
Yes, yeah. You're supposed to just do it with volunteers, but I don't know how a volunteer could understand all that information. And we have 2 people specifically designated to do that in our office because it is so
It
needed.
is confusing.
Mhm.
Yes, Supervisor.
Thank you, Mr. Chairman. Dee, with your intimate knowledge of what these programs being cut potentially could mean to Warren County, how do you see that affecting, Warren County day-to-day life for, the people that it's going to affect and the people that are relying on these programs? I mean, just, full disclosure, I hear all these programs being cut and I've sitting here and I'm trying to think in my head, you know, what does that actually mean to day-to-day life? And how is that going to affect the people that are depending on the programs? And, you know, what is it gonna do for some of our residents, in their day-to-day life?
So depending on how the county handles it, I mean, if the county continues to put in the extra money, which could go way up in 2026, there would be no impact. But if they don't, and understandably, if they can't, because it's gonna be a huge increase, we could see seniors going without meals, transportation being eliminated. There's not gonna be the long-term care and budget program, so there's not gonna be any advocacy for seniors that live in nursing homes, assisted living facilities. Our health insurance program is gonna be reduced as well. So not as many seniors are gonna be helped, so they're gonna be getting into programs that they can't afford.
What health insurance program are you referring
So
to?
the Medicare, Part D programs, CDPHP, used to be WellCare, Blue Shields, different things like that.
Thank you.
We help the people determine which one is the best one for them, where they can get the most bang for their buck and it's not gonna be costly. But programs like that are gonna be reduced, and Medicaid, the impacts to Medicaid are not gonna be good either. So you're gonna see more people needing services and we might not be able to provide it.
That seems like a scary overview.
I mean, I think there are some revisions or tweaks that need to be made with all of our programs, but to just eliminate them completely without thinking about it, I don't think is a good idea, but that's my personal opinion.
Thank you.
Okay, anything else?
That's it.
All right, thank you, Dee.
If you guys do have any questions on the annual report, or if there's anything that you would like to see included in it, please let me know and I'd be happy to do that.
Thank you, Dee.
Hopefully, oh, I did go over my time, I'm sorry.
Well, I knew you were.
I tried to keep it short.
We did.
Thank you.
Wow. Joining us. This is board meeting.
Okay, public health will be here in just a second. All right.
Oh, same mic. Yeah. You have one? Nope. You have it?
I have it, yep.
You have it?
Thank you.
How are you?
I guess so.
Was that your turn? Oh, you do have one, okay. Anybody else need
Okay, so we'll call the public health to order. Approval of the previous minutes.
No, you already.
Oh, close. Thank you. Privilege of the floor. Anyone from the floor have anything they'd like to address the committee with? Now is your time to speak. Knew that was coming. Yeah, right ahead.
Does this actually work?
Well,
I can just shout.
it works.
I am John Ruggie, formerly known as Dr. Ruggie. And just very impressed by the last presentation in terms of all the services provided as a county. Some 8 weeks ago, a group of physicians got together, decided we should also have an informative process about another program called Medicaid. Initially, just the physicians offering their experience. We were very quickly joined by a good number of community members and community leaders. So we now call ourselves the Healthcare Coalition for the North Country. Our mission, our goal is to help to explain why Medicaid matters here. We are absolutely nonpartisan. We're not taking sides. We're not even making any recommendations on which program, which cut, but instead have some confidence that if we explain about Medicaid carefully, that will help decision makers come to the right place. As it turns out, Medicaid is much more complicated than I ever knew. But we've been doing our research and trying to be as authoritative as we can to explain why this is important to 28% of our people who are Medicaid covered. And also to 100% of our people who could be impacted by cuts that are more inadvertently pervasive or damaging. So our messages are kind of threefold. What the intent is. One is to speak to the needs and the benefits being given to the recipients. There are a number of them, 28%. And I think it's pretty obvious that having healthcare assures the easy availability of healthcare, and especially for preventive services and all those that, in my view, really save money in the healthcare system, could otherwise become neglected for at least some of those people. Our second concern is that of the healthcare providers themselves, with 28% of the population depending on that service. Not quite that much revenue, but all the same significant revenue goes to our hospitals, our nursing homes, and our medical practices. If that's significantly cut, it could be a cutback in services that could be, again, damaging. For the hospitals, for example, 40% of all deliveries are covered by Medicaid, 50%. And if that were to leave the area, it'll be of concern. And there is now only one OBGYN practice in the whole greater Glens Falls area. Because the previous remaining practice had lost one physician and they couldn't find another. They couldn't recruit. So that's the kind of risk. People in labor having to drive an hour or two to Albany would be unfortunate. And because, let me go on to the nursing homes, more than 60% of the nursing home residents are also Medicaid, and they are already in a very delicate, difficult financial position. If we were to lose those facilities, you can imagine, where would they go? Home, hospital, squeezing access for others. Regarding medical practices, including clinics, health centers, there's a special concern about rural areas, and that most of our rural communities have only one medical practice. And my personal experiences, having been there for some time, is it is impossible, having practiced in that town or even coming to practice, to tell somebody coming to the front door of the office saying, I have a laceration, I have a sore throat, I have chest pain, to say, no, we can't do this anymore. Medicaid is not paying, and you're not paying. And that would be obviously disastrous for those communities, because if the health practice leaves, so does the pharmacy. And people go for shopping for those services, and they go grocery shopping, more variety, and gasoline shopping where it might be cheaper, et cetera. So the consequence, in my view, is cuts that are not carefully done could affect all of us, no matter what kind of insurance we have. And that needs to be paid attention to. To that effect, we've developed a series of booklets or pages, not books, they're pages, 3 or 4 pages of Medicaid facts, which we've done our very best to be careful about. It turns out that there's a lot of contradictory information, even how many Medicaid people are there in this region. And found 3 assorted sources that have all the same information, but otherwise it can vary from 44% to 19%. It's very confusing. So we're glad to have an opportunity to just let you know this thing exists. We do have a website. It's called northcountrymedicaid.org. northcountrymedicaid.org. And there's more information that anyone would like, either at the town or county level. We think all levels of government need to be well advised of this. Whatever happens in Washington is going to come back to Albany to say, well, we do something different here to make up one cut or another that might particularly affect New York State or affect this North Country region. And so we're trying to be informative and as neutral and as helpful as we could be to the real decision makers who start with you. Thank you.
You have a question?
Yeah. Have the specifics of these cuts been laid out anywhere, or do we know specifically what will be?
Yeah, it's a dynamic process. There are several committees involved. The Committee for Energy and Commerce has direct responsibility for 3 programs: Medicare, Social Security, and Medicaid. Speculation is that Medicaid is getting the most attention. Originally, for that committee, the reductions over the 10-year period is to be $880 billion. It has been adjusted along the ways. And this has also gone to the Ways and Means Committee, the Budget Committee, but they're getting closer, but not to the final line yet in terms of what kind of adjustments to make. New work requirements, possible adjustments in what the feds pay for versus state FMAP program, and concerns about just how to reduce costs, which are certainly high. Healthcare costs in the US are the highest of any nation in the world. And so one concern, this personal concern for me, is if that is tried to take it out of any one program, the whole system gets damaged. What we need to do is have a careful reform of the system to make it more effective, cost effective, not more costly, cost effective, and still maintain or possibly even improve the care.
But have they spelled out the specific programs that are gonna be affected or cut or what have?
Well, plans include cutting out access to able-bodied working or citizens. And with a monthly report, we were required about having worked at least 20 hours a week. Current data shows that of those Medicaid recipients, 3.4% are able-bodied, need to be able to work, and either can't find a job or are not trying. So it's not a huge percentage, but there are slivers here and there that are certainly of understandable concern. There's probably not going to be a reduction in federal percentage of compensation of payment versus state, but things can change. The programs that have expanded Medicaid coverage from those below poverty to those of 138% of poverty are also under serious consideration because this is for poor people. Unfortunately, because of the cost of healthcare, it represents a remarkable significance. By federal standards, not by state standards, by federal standards, 138% of poverty for a family of 4 equals $44,000. If there is no health insurance available through Medicaid, and they're looking to buy commercial insurance, the average price for that family of 4 is $26,000, making it really impossible. And so if we have those levels of uninsured again, that has the damage that I alluded to earlier.
Thank you.
Any other questions for Dr. Ruggie?
Thank you for your
Thank you so
time.
much.
Thanks.
Appreciate it.
If you have any further help, let us know. Thank you.
Thanks again.
Okay, anything else from the public? Have anything they'd like to bring to the committee? Seeing none, Pat, you're all set?
Okay, thank you. We only have one resolution request. It's to amend the 2025 budget to reflect both the revenue and expenses related to the Department Code A 4197 for the balance of the grant for public health infrastructure workforce data systems, which reflects $221,130 funding from the 5-year grant originally allocated annually $110,565 per year over 5 years, which represents the last 2 years of the grant. New York State Department of Health HRI approval was provided to utilize the funding anytime through 11/30/2027. So I'll turn it over to Tom if there's any questions or rationale, but.
And
pretty
just
straightforward.
attachment one is just moving the money into revenue and to expense. And right now, our construction downstairs is with furniture that we need, we're replacing a lot of things. They're very old. So we put it all into furniture right now for the 2 years that we're looking at, the last 2 years, to put all that in there this year. If we need to spend it, we will. If we don't, it'll move, it can roll forward until 27.
Okay, can I have a motion to bring this to the floor? Supervisor Runyon, second Supervisor Gilligan.
Oh.
Any questions for Pat on this or Ton? Seeing none, I'll call the question. All in favor?
Aye.
Opposed? Okay, carries.
Next is attachments 2 and 3, which are our financial status as of, April 25th. Gives you an idea of where we stand. We have, accrued our March revenue for our home care. Noting again, I always do down at the bottom of our salaries line that we are 27.79% of our budget so far this year. And at this time last year, we were at 29.63%. So we're a little under, which is good in savings. And then looking at our comparison on attachment 3, again, just giving you an idea of where we stand. Overtime is down obviously because we hadn't had to put in the time. Our part-time again is down. We had people in there that way before we had to help with clinics or anything, but things have calmed down a little bit there. And we're limiting some of our clinics, like our rabies clinics and stuff. So we're not seeing that extra time and part-time that we used to have to deal with. Our revenues are up to date, all under the equipment line. Right now, it's showing 49,000. And I was just gonna mention that again is all infrastructure up to date. We have our new infrastructure grant that we're working on now with our purchase orders that we've ordered and we're waiting for those. But this is just for phase 1 was about $49,000.
Okay, any questions from the committee for Ton? Pat? Anything else?
So as far as continuing on our agenda, our regular attachments are there. As far as emergency preparedness, rabies, it is rabies, May is what Rabies Awareness Month. You have the rabies clinic. We've had 2 rabies clinics already, and you have the list of clinics and dates and times. Health Services Federal and State Grant Overview, please see attachment 7. Many thanks to Marie DiLorenzo, who is our business specialist and happens to be here, who has assisted with the organization of the health services grants and serves as a liaison between the New York State program and fiscal staff. Marie's done a very nice job for us, so thank you, Marie. Moving right along, the Warren County Tick Reporting Initiative, that's on attachment 8. We want to give thanks to Olivia Cohen, our senior public health educator, for her vision, oversight, and implementation, and to Amanda Baker from GIS for the tech assistance, development, expertise, and collaboration. The application was recently highlighted on Spectrum. If you want to refer to the link below, and you can also see it on your handout. We want to thank Don Lehman as well for his assistance for publicizing that. The next is, I know it's already, it happened on Monday, but we had a car seat safety check. It's our first one. So we're finishing our first grant year, and we have applied for our second grant year. Jignasha Shah has been instrumental in that. She's our public health program manager. She also works part-time as a WIC coordinator. So she's very busy, and that event was very successful. So we're hoping to have more. And just one more thing, we just wanted to highlight a couple of our staff and say congratulations. One is to Jignasha Shah, as I just mentioned, and Olivia Cohen, who also I just mentioned above. They have both just completed their master's in public health. Yeah, working full time. Yep. So they went to SUNY Albany School of Public Health, and they're both dedicated employees. They exemplify professionalism, teamwork, initiative, and leadership. We want to recognize, both have been recognized by the Board of Supervisors as Employee of the Month or Employee of the Quarter. We're thankful for the Warren County's investment and funding toward continuing education. This hasn't just helped our office. We're benefiting from it, the community's benefiting from it, you know, the county is benefiting. And like I said, these two are doing extremely well for our office, and we're really lucky to have them both. Yeah, so thank you for the continuing education. We appreciate that. And that's all we have.
One, it was nice, the one girl, said that she wasn't leaving, and that was nice to hear.
Yeah.
They both are saying that, so I hope they don't, because they're doing a really great job for us.
Yeah.
I can't tell you how much.
It was a nice presentation for them.
Yep.
Anything else?
I have nothing else. There's no
Anyone
question.
from the public have anything they'd like to address us to? Okay, seeing none, can I have a motion to adjourn? Motion by Supervisor Bruno, second by Supervisor Patchit. All those in favor? Opposed?